All right, this morning we are discussing subaortic stenosis when it comes to dogs, often abbreviated as an SAS or SAS in veterinary medicine. This can be a genetic in Goldens though, but certainly among other breeds as well. Dr. Jerome Williams and Dr. Ingrid Strader are here today to tell us more about this, and they've brought the most, I can't pay attention to anything that's going on because of Dr. Strader's puppy. Oh, who is this?
Yes, this is our little bear Arctos, and she's a 15-week-old golden retriever puppy.
She's so perfect. Yes. She's just sitting there. Thanks to Mike. Mike thought about putting the chair up there so she could sit up here.
So well behaved too.
So well behaved. Well, she better be. The doctor's in charge, right? But this is a serious problem, though. And Goldens can have this, but certainly other animals as well, right? Or other dogs.
Absolutely. Yes. Other breeds have it as well, but it can be predominant in the larger breeds. Mm-hmm. And it is one of the congenital issues, meaning they were born with it. And it is a narrowing of the outflow tract where the left ventricle has to pump into the aorta. And in people, very commonly, the valve, the aortic valve, is narrowed, stenosed, thickened. And in dogs, it's often a little bit of a tissue ring underneath the valve, which is why it's called subaortic.
All right, show us, we're looking at this here.
This is where you can actually diagnose it with. It's an echocardiogram picture.
And so this is a dog with that problem?
Unfortunately, exactly. So LV, so that's the left ventricle. You can quite see that the walls are thickened, but they are. And then you have the valve of the aorta there, labeled on the 1 o'clock and 2 o'clock. And then that ridge, that is actually where that stenosis or narrowing occurs. And
are there things that you would notice right away? Or is it known
not.
Right when they're born?
You know, the problem is it's usually not severe enough to really be noticed like that. So when they go to their puppy visits, and I can't stress enough how important it is to go to the general practitioners to make sure not just to vaccinate them, but that they are actually okay. You need to be listened to, and then you would
listen for the heart sounds and see if there's something that concerns us.
Exactly.
So if somebody brings their puppy to you, then if you heard that, you would refer them to a specialist?
Yes,
like
I would.
Dr. Strader.
Yes, I would. But there are other puppy sounds that you mentioned earlier that you got to be aware of to try to differentiate this, but especially in large breeds and in Goldens, you want to be more attuned to it.
You want to be focused on it because there can be what is called an innocent heart murmur. And that will often go away as they age, but you can't wait too long because you can't just listen to it and go, oh, this is innocent and that is not. It's really difficult to differentiate.
So we've only got a few seconds. What's the first thing that happens if it's diagnosed?
If it's diagnosed, you can see if it is mild, moderate, or severe, and depending on that, you can treat them accordingly.
Okay. All right, but your baby's perfect, right?
Yes, she is.
Okay. She's how old, 18? You said 18?
She's 15 weeks.
15 weeks old,
yes.
So she is just a baby.
She is.
She's beautiful.
Thank you.
All right, you guys hang on because we're going to take a look at our pet pick. What's your puppy's name?
Bear.
Bear. Bear, take a look at this. This is Sam. I know. So Sam is a sweet 11-year-old Chihuahua mix. And we're told, docs, that he's a little nervous boy, but always is up for an adventure. So thanks to Stephanie Jensen for sending in your sweet Sam. Sam goes camping, rides in the boat. Sam's got a good life, looks like.
It looks like it, doesn't it?
All right. Thank you for sending those pictures in, Sam. And Good Day Pet Pick at WBRC.com is where you send those pictures. We sure do appreciate it, and we appreciate Dr. Strader and Dr. Williams and that sweet angel right there.
Thank you.